take you to the French city of Strasbourg, to an operating theatre. An intense beam of light shines down onto the patient. The theatre equipment whirs and bleeps, and the smell of disinfectant has infused with the apprehension that hangs in the air. The patient is a 68-year-old woman. She's having a cholecystectomy, which is a routine clinical procedure. But this case is far from routine. The surgeon's hands and eyes are immersed inside the patient. But the surgeon is not by the patient. He's not in the same room or in the same hospital. In fact, he's not even on the same continent. The surgeon is nearly 4,000 miles away in New York City. This was the Lindbergh procedure. But just how was it possible, you ask? How was it possible that this surgeon got this superpower of teleportation? Mr. Toastmaster, fellow Athenians and welcome guests, this evening you're going to hear about how robots are turning your surgeon into a super surgeon. You probably all pondered at some point in your life what it might be like to have a superpower. Teleportation, invisibility, X-ray vision. If there was ever a moment, or if there was ever a job that required a superpower, it would be surgery. Take microsurgery, for example. This is very delicate surgery that is undergone with a microscope. The surgeon intuitively and exquisitely dances, the forceps dance an exquisite ballet as they sew together blood vessels that are so small they can be barely seen by the human eye. Imagine having this job. There is absolutely no room for error. The stress is acute. Adrenaline pumps through the surgeon's veins, and it all contributes to their tremor. We all have tremor, even surgeons. And under a microscope, the surgeon's tools oscillate back and forth, in and out of focus, uncontrollably. But with the microsurgical robot, the surgeon can position their instruments without any tremor whatsoever, smoothly and with a precision that only a machine could achieve. And you may have thought with this type of surgery, the surgeon can barely feel what they're doing. But the robot can feel well beyond what the human can feel. This is superhuman touch. And this can be relayed back to the surgeon. You see, we first had radio to recreate sound, and then television to recreate moving images. And now we have haptics, which can artificially recreate your sense of touch. And this technology is now so advanced that the surgeon can pick up and feel objects as small as a human embryo. The next superpower is metamorphosis. This is the ability to morph into different forms. And the surgeon can effectively shrink themselves down to be so small that they can be swallowed by the patient. Imagine that, being able to casually stroll around inside the patient's body. But it means that the surgeon can operate from within without having to make a single incision to the patient's skin. And these surgeons can morph into other things too. Snake-like creatures that can intricately navigate, slither through blood vessels and reach parts of the human body that the human hand simply cannot. reach. X-ray vision. How about that? The surgeon can see delicate anatomical structures like blood vessels and nerves and more sinister things that lurk beneath the patient's flesh. The surgeon can now see where the cancerous tissue ends and the healthy tissue begins. And the final sick superpower of the super surgeon is invisibility. The surgical robots of the future will be so small that you won't be able to see them with your eyes. They will swim in your blood, pervasively monitoring your health and intervening before the first sign of trouble. So when I mentioned the words robot and surgery, what was the first thing that you thought of? Perhaps it was Arnold Schwarzenegger dressed in scrubs, or C3PO holding a scalpel. But surgical robots are not autonomous, scalpel-wielding beings. They are intelligent tools that are designed, intended to augment rather than replace the surgeon. It's about the perfect fusion of human and machine, of intelligent clinical decision-making and robotic precision, about making surgeons into super surgeons. And this benefits the patient. It improves their quality of life, because for the patient, it's important to add years to their life. But it's as important that we give life to those years.